us know what the leading type of cancer is in the United States. I always thought that the leading type was breast cancer when actually it's not. It's actually lung cancer. And when I learned this, I started to think about it, and I believe it because on my mom's side of the family, 6 people have had lung cancer and ended up dying from it. So I'm doing my informative speech on lung cancer because it affects me personally, and I kind of need to know about lung cancer considering it's kind of a family genetic type thing and all that stuff. So my informative speech will kind of be about just the basics of what lung cancer is, like treatments, stages, causes, what you can do to prevent it, and some symptoms and stuff like that. Lung cancer is abnormalities in the body's cells, which is focused on your lungs, and the types of tumors are benign and malignant. Benign meaning that it can be removed by surgery and most likely it will not return. And malignant meaning it's more aggressive and it can spread throughout the body, causing surgery to be a little bit less likely. 95% of lung cancer is found in the outer part of the lungs and in between the airways. The classifications for lung cancer is small cell lung cancer and non-small lung cancer. The non-small is about 80% and then the other 20% will be the small. And small cell lung cancer is the most aggressive type of cancer that there is. The stages of cancer tend to vary depending on if the tumors have strictly stayed in the lungs or if they have spread throughout the body and how big the tumors are. The 3 major types of treatment are surgery, radiation, and chemotherapy. Most doctors like to go the surgical route if it has mainly stayed within the lungs. And if a patient refuses to go the surgery route, radiation would be the next one. And radiation is high energy X-rays which kill the cancer cells and divide them up so they can be broken down. And chemotherapy can be used with non-small cell and small cell, and it is the therapy that stops the cells from growing and also divides them up too. Chemo can be in 2 forms, in the pill form and infusion. Doctors like to use the pill form for kids because the pill forms are less aggressive and won't hurt the children as much and will have less effects, like less nausea and stuff like that. The major causes would be smoking and passive smoking. And passive smoking is pretty much just secondhand smoke. Radon use is another one, air pollution, genetics, and if you have been diagnosed with lung cancer before and it has come back. Some symptoms would be chest pain, wheezing or difficulty breathing, and then another one would be a consistent cough or a serious, very serious cough, and weight loss is also another symptom for that. A good way to prevent cancer is try to avoid any use of tobacco. And in conclusion, I think it's good that everyone should know a little bit about lung cancer so that, if you have family members with past history and stuff, you can keep an eye on it just with friends and family and for yourself to make sure that you don't get a very serious lung cancer. Thank you.